Good afternoon, Mr. Mayor, City Council. My name is Dr. Ned Rueben. I'm the chair of the Unified Prevention Coalition of Doña County. And first, let me thank you for giving me the opportunity to stand up. I've been sitting a long time, as have you.
Dr. Rueben, can you move your microphone pointed towards you a little bit? There you
Sure.
go. Thanks.
Is that better? Thank you. The mission of the Unified Prevention Coalition is to build collaboration around efforts to reduce and/or prevent youth drug and alcohol use and misuse, address factors that increase risks of usage, and promote factors that increase resiliency. And I'd like to have you think a little bit differently right now about this issue of the zoning. I don't want to talk about the business, and I don't want to talk about individual consumption, medicinally or adult use. What I want to talk about is from the perspective of prevention and public health. With that in mind, according to the latest New Mexico Youth Risk and Resilience Survey, more than 25% of Doña County youth in the 9th through 12th grade report using cannabis. It also reports that New Mexico has a higher rate of cannabis use before the age of 13 than any of the other 46 states that participate in this survey. As a countywide substance misuse prevention organization focused on youth, the Unified Prevention Coalition wants to be quite clear with the City Council about our position regarding cannabis business locations in the zoning buffer. We do not want you to change it. Recent research, and I'm going to give you my comments with the references and the citations that I'm using today. Recent research reports that there are several things to consider based on the experience of other states that have legalized adult use cannabis. Their study focused on the influences of advertising exposure, numbers of marijuana retailers, distance to retailers, and outcome beliefs, perceived norms, and efficacy on youth's intention to use marijuana in the future. They cite data from multiple sources to support the assertion that proximity to retailers and density of tobacco and alcohol outlets have been found to influence youth's substance use. The number of retailers near schools in the area around the participants' homes and in participant city have been positively associated with youth's substance use. Tobacco advertising was associated with outlet density, and youth were more likely to smoke when the neighborhoods of their school or home had a higher density of tobacco outlets. Presence of e-cigarette retailers near middle schools was associated with an increase in middle school students' e-cigarette use. Similarly, youth who lived near alcohol retailers, considering the comment you just made earlier, Mr. Mayor, youth who lived near alcohol retailers were more likely to buy and use alcohol and experience problematic alcohol use, such as binge drinking and drinking and driving. So clearly, proximity to other retailers, advertising, and density of outlets have been found to increase the likelihood of youth substance use. As another researcher notes, the retail environment is recognized as an important social determinant of health. They further conclude that their main finding was the presence of a specialty e-cigarette retailer near a middle school is associated with increased likelihood of lifetime e-cigarette use among its students.
Dr. Rueben, I gave you an extra minute.
I know, I have to stop. So yeah. I appreciate the time. I'm going to give my comments, if I can, to the city clerk, and you'll have a chance to read them. So let me reiterate once again, we are not in favor of reducing the buffer zones because the density of retail outlets influences what you think about normalizing use, that it's less dangerous. Thank you.
Yeah, thank you.